Any treatment for sport-related problems must be done with the welfare of the horse in mind. The veterinarian has an ethical obligation to be mindful of future effects of current treatment. You don't just treat them for today, you treat them for their career. The competition regulations may dictate what therapy and medications may be appropriate, depending upon whether you're competing in FEI competitions or you're competing in USEF competitions that are not FEI rules. Then there may be differences in medications and things that you could do. While many injuries occur, treatment is often directed at joints, as we know. Certain joints of the limbs are more commonly affected with chronic repetitive trauma. Subsequent inflammation needs to be addressed. For example, the hock, stifles, and distal interphalangeal joints, which are the coffin joints, and the podotrochlear apparatus, which is the navicular bone, bursa, and deep flexor tendon that work with it, and the ligaments that support it. Acute and chronic suspensory ligament desmitis is, or desmopathy, which means pathology of the ligament, are issues. Back and neck issues and flexor tendon injuries. A lot of these things are not just one moment in time injuries. Many of them are chronic repetitive trauma. It's like the baseball pitcher that throws too many curveballs. Elbow gets sore, okay? And so it's just one of those things where we need to be cognizant of what we're doing in our work, and that chronic repetitive trauma can lead to degenerative problems. Palmar foot pain is probably the most common malady we see, as I mentioned before. Axial skeletal conditions are much more common than we once thought. This is an example of two scintigraphy scans that demonstrate arthritis of the dorsal spine of the facet joints. This is the pelvis. This is the back of the shoulders here, or the back of the rib cage, I'm sorry. And this is the lumbar spine here and here, pelvis here. This is a dorsal view looking from above. And we can see a high concentration of radioisotope in these two different horses that have arthritis in their low back. So this is certainly something that could affect a horse's ability and willingness to engage, for example, and to flex the lumbosacral joint if they have low back pain.